Hello, my name's Clayton. I'm a Senior Product Manager here at Access. Access Intelligent Care Platform supports the new NHS plan for neighbourhood systems. We know that demand is growing, we know that costs are spiralling, and trusts need to be very mindful about all the data that is siloed in different systems within the neighbourhood. Access Intelligent Care Platform provides an overview of all the different personas that are involved with care in the neighbourhood health system. We know that lots of teams work in different ways, but they are all responsible for delivering care to one patient. So it's not just a patient diary, it also allows teams to come together to provide the right kind of care for that patient. Access Intelligent Care Platform is not a shared care record. It allows users to understand what's happened with that patient in real time with proactive alerts. The real difference is that it can tell you what's happened to that patient so you can be ahead of the problem. With AICP, we want to put lots of at-a-glance visuals. We want to work with users to understand what's the right thing that they need to see very quickly. They're not paid to read and extensive notes through all kinds of different systems. They're not paid to click. They're expected to treat. We want to be able to provide the software that allows them to do that. AICP can directly support community teams. How? It uses technology through Access Evo and the event feed notifications in that, and also the AICP integrations to bring in real-time data and real-time alerts. If a patient's been admitted to A&E and you're about to go and visit that patient, you can change your schedule to accommodate that plan. If that patient's care plan has been changed, you can then turn up at that patient's property better prepared because you've been told about this ahead of time. AICP provides better insight about a patient and their surrounding network. For example, if a patient is a caregiver, AICP can surface the info around the patient that they provide care for. That way, the teams can then coordinate better care around that patient as well as the caregiver. We know that a healthcare professional can travel out and see a patient, and they have to see X amount of patients in a day. If that patient's not at that property due to say they've had a fall and they're acute, then AICP allows them to understand and see where that patient is. Without AICP, you have a healthcare professional that's travelled out to that patient's address. They're knocking on the door. They can't leave that address until they've located and understood what situation that patient is in before they can move on to their next patient. AICP helps with this, gives better insight into where that patient is and the care that they're receiving. AICP can support a number of different users no matter what their role, from local government where they need to be able to see and understand health aspects of the patient's care, to community teams where they need to understand what's happening with that patient and when, what's the interaction with local government, what's the interaction with other services. AICP brings that all together in one unified view. AICP can improve efficiency, lower the cost to serve. By bringing your teams together, providing that care for a patient or a group of patients, they can be better coordinated. You can reduce the number of visits to that patient's home and ensure that their care remains at the highest level. Neighbourhood health system is the future of the NHS, and AICP is there to support it. We know it's going to be a difficult transition for a lot of teams to move towards this, and AICP fully supports that. If you start to think about sending a patient out into the community, having that outpatient virtual care there at their home, you need to be better prepared, you need to be on the front foot of what you do with that patient, and AICP allows you to deliver that.